for some, so others might eat. I'm a case manager. I was invited to speak about resources inside the community, but most of the people in this room pretty much know what the resources are. I love what you just said about need. One of the things that we as professionals have to recognize is that a person can need this all they want, but if they don't want it, it's not going to work. All right? So how do I instill that want into the people who I'm trying to help? Like right now, I have a caseload of 75 people. Some just closed down their safe haven, right? They're limiting their IOP services because they're $4 million in a hole, right? They shut the whole safe haven down and moved them to West Virginia and graduated some people early so that they had a place to send these people. So now we just lost another resource, right? You got CAG, you got APRA, you got DC recovery centers as the gateways to get people into treatment. But what happens when the funding is not there for treatment to exist? Right? So how do I work? Now let me back up a little bit. Right? I learned this industry in Philly. All right, I worked for the largest faith-based drug and alcohol program in the city of Philadelphia for close to 2 years on a stipend of $80 every 2 weeks. While I got my certifications, I'm a certified forensic peer recovery specialist, certified recovery specialist. I am behavioral mental health specialist. I'm about that close to getting my degree if I ever go back to school. But you said something that I hate to say this, Doc, but I disagree with, right? You said a person cannot recover if the neighborhood environment is totally destroyed. I beg to differ, because North Philadelphia is the worst drug community in the entire country. All right. Unfortunately for me, right, I've been on my own since I was 17. I grew up in the streets of New York and North Jersey, which are the worst streets in America. The life expectancy of a Black or Latino in 1981 when I graduated from high school in North Jersey was 19 years old. All right, the expectancy on going to prison was by 21. I can remember my counselors in the 8th grade telling my parents if I went to the public high school, I'd be dead or in jail by the time I was 17. They were wrong by 2 years. So like, there's a song by an artist called Lecrae who says sometimes the only way to survive is to sell drugs, go in the military, or go to jail. All right, I've been in all three. We have to change the mindset, right? If we don't learn to change the mindset, nothing is going to change. Unfortunately, the 80s changed the mindset in the opposite direction from where it was going in the 60s and 70s when crack hit the streets and started a new epidemic that not took one generation, but took 3 generations. Because the generation that was born in the early 60s ended up in prison in the 80s, and the kids raised kids that now have children that have no concept. And this isn't color. Because I guarantee you, most of the dope fiends you see in Kensington and Philadelphia are white.
That's right. That's right.
And they ain't from Philly. They're from somewhere else. Baltimore. They ain't from Baltimore. They're from somewhere else. DC. People get stuck here because of the quality of the drugs. But the thing is that as providers, I honestly have to go to what has traditionally worked and say, hey, you need to go to a meeting. Because that is the only proven thing that has ever worked. But if I don't have the image to see people going back to the peer recovery support of people who have successfully done this, right, then what do I do? Right? I teach change in thought dynamics. I teach CBT, REBT. I teach people how to understand that I too stood in front of 7-Eleven. I lived in an alley for 6 months in downtown Philadelphia in the winter of 2006 and 7. I did not know how I was going to get out of that. And one day, one thing I did tell people, One day it's going to happen. It's not going to be because of anything I did. It's going to be whenever I figure out what God wants me to learn, it's just going to happen. And the day that I said, when I quit, my life changed. But the debt that I owe to society, I still had to pay for some of my actions in the street. And when they paroled me right back to the same strip that I call all four North Alpha. Right? All four of my cases for selling drugs. And I had to walk through that every day. I had to pray my way down the street. I had to come out my front door and tell them, you can't smoke crack on my steps. I ran recovery houses. We had 3 on the same block. Right? I had a total of 8 houses, 120 people, run by a little bitty church. Our sanctuary wasn't much bigger than this. But we were effective because we took the time to treat all the needs. You cannot treat a person just for substance abuse without taking care of their mental health. You cannot treat a person for substance abuse without taking care of their medical health, right? I cannot treat people for substance abuse without getting to the root causes. And I'm going to say 2 things and then I'm going to shut up, right? In the traditional 12-step program, it says, step 1 is we made that we're powerless over alcohol, drugs, food, sex, whatever, and our life became unmanageable. I always ask people if that's true. And when they tell me yes, I say absolutely not. Why? Who were the steps written for? Bill Wilson, Dr. Bob, AA number 3, all of whom, Bill Wilson was a stockbroker, Dr. Bob was a doctor, AA number 3 was a highly successful corporate sales rep who lost all their goddamn money during the Great Depression. That's when they became alcoholics. All right. I didn't have money. My life was unmanageable before I ever picked up a drink or a drug, which goes back to what the doctor was talking about. If I don't fix the things that were systemically wrong with me to begin with, having low self-esteem, low self-worth, negative self-image, growing up in an environment where, I seen my first person get shot when I was 5 years old, 1969, right, on 158th and Broadway, right? If I don't fix the things that made me hate me, then I'm never, ever going to learn to recover. So my unmanageability preceded my use of drugs. And I think that we have to change the perspective on how we get people to viewpoint. Like, I can handle the streets. I'm still alive. Everybody I know who can't handle the streets, they're dead. Or they're locked up forever. Right? And I can't even that people being locked up forever. But the unmanageability of the streets, I'm comfortable with that. I ain't scared of that. I know I can survive being homeless. I know I can survive addiction. I know I can survive going to jail. What I didn't know how to survive was being me. What I didn't know how to survive was being responsible, being productive.